But the fact is, no federal entity has done more to raise this issue than our colleagues at the FDA. And so I'm very proud to now introduce FDA Commissioner Scott Gottlieb, my friend, my colleague, and a strong, strong advocate for reducing e-cigarette use among youth, to come and talk to you about how they're addressing this issue. Dr. Gottlieb?
Thank you all for joining us here today. I want to thank the Surgeon General and others for coming, and I want to thank the Surgeon General and the Secretary for the attention that they've shown to this issue. It's helped galvanize support for the actions we've been able to take to address what we see as an epidemic of youth use of e-cigarettes, an epidemic that's now been confirmed by two different surveys, two different very rigorous surveys, including the National Youth Tobacco Survey, which we released about a month ago. We've started to take some aggressive steps. We're going to be continuing to take steps over the coming months to try to address this epidemic use of e-cigarettes by youth. We've launched the first ever public service campaign targeting youth with messages about e-cigarette use. It's my belief that we've been successful in this country at stigmatizing tobacco use among kids. Kids recognize that using combustible tobacco products is unhealthy and wrong. We haven't had the same success when it comes to the e-cigarettes, and we need to reverse that. We need to start educating youth, teens, children about the dangers of using e-cigarettes, and that's what our campaign is targeted to do. The other key component of what we're trying to do is limit the access and appeal that these products have to kids, and that starts with the role of the flavors. As the Surgeon General noted, the flavors are the primary vehicle by which kids are initiating on all tobacco products, not just e-cigarettes, but also combustible tobacco and flavored cigars. And we need to address the flavors across the board. And that starts with addressing the flavors in the e-cigarettes. And so FDA announced last month a series of policy steps to put in place significantly enhanced age verification requirements for the flavored products in convenience stores where we know a lot of kids are accessing these products. We'll be following through on that commitment in the early part of this year and enforcing those measures. And we're also going to be stepping up our enforcement activities when it comes to the sales of these products to children. You're going to see FDA taking some aggressive steps in addition to steps we've already taken in the past months to target the sites where kids are getting access to these products, which is increasingly the convenience stores. So we're going to be in those stores doing our own surveys, doing our own undercover purchases, and holding people accountable when they sell these products to kids, and holding them accountable when they're recidivists and they're repeat offenders and continue to sell these products to kids. I want to just close by telling you how important it's been for FDA to have the support of the Surgeon General and the Secretary as we've advanced these steps. They've been steadfast in their commitment to these issues in trying to see us address these really epidemic proportion of use among children and trying to resolve this crisis. And we're committed to doing that, and I'm hopeful we will. Thanks a lot.
Well, thanks again, Dr. Gottlieb. You know, in government, it can be tough business. And there's a saying that if nobody's happy with you, then you're probably in the right spot, right in the middle. And Scott has taken a lot of hits for his stand. But I want you all to hear me say this again, that neither Scott nor I are against exploring the harm reduction potential of these products. But we will not stand for another year of exponential, unprecedented, historic rises in youth use of these products. And we both are convinced that there is balance to be found in this situation. But I don't want you to just take it from the federal government. We want you to hear from two people who have firsthand knowledge on this issue. We've got two very special individuals who've graciously agreed to join us and to share their experiences. I'm going to quickly introduce both of them. The first, who I had the pleasure of meeting this morning, wonderful, wonderful young lady, Miss Sarah Ryan. She's a high school senior and passionate tobacco control advocate from Holbrook, Massachusetts. Sarah's actually applying for colleges right now, so anyone who's listening, if she's on your list, you all need to accept this young lady. She's a member of the 84 Movement statewide leadership team and a national youth ambassador for the Campaign for Tobacco-Free Kids. In Sarah's time as a young activist, She's testified at local hearings, planned many statewide events, been interviewed by media outlets, and spoken with various people within Congress. Sarah also co-founded the youth branch of her town's substance use coalition called Bulldogs Care. She believes in the power of young people using their voice and wants to show other youth how they can change the world. And Dr. Mila Vascones-Gatsky is an Arlington, Virginia public school substance abuse counselor. She's available to students who've been referred for issues related to substance use. She's trained to listen and respond effectively to the needs of students, families, and community groups. Originally from Peru, she received her bachelor's in psychology from the Catholic University in Lima, Peru, her master's in clinical social work from the University of Maryland in Baltimore, and her doctorate in counseling psychology from Argosy University in Arlington. And her father-in-law, she told me earlier, is in the Pro Football Hall of Fame, former Cleveland Browns player. So you've got to make sure you introduce me to him. But Sarah, please come on up.
Good morning, everyone. I wanted to thank Secretary Azar, Dr. Adams, and Dr. Gottlieb for focusing on such an important issue today. Unfortunately, the e-cigarette epidemic is an issue that I know all too well. I got involved in tobacco control about 3 years ago after seeing kids younger than me start using e-cigarettes in my hometown of Holbrook, Mass. I have family members who started smoking when they were kids before they realized how dangerous cigarettes could be. I'm worried that we're seeing the same issue now, just a few decades later, because kids are being targeted with e-cigarettes, unaware that these new products could get them hooked for life. In the past year, the use of e-cigarettes has exploded in my town. Until my town passed a local flavor restriction just a few months ago, the convenience store directly across the street from our high school sold a myriad of flavored tobacco products, including e-cigarettes. Vaping has become ingrained in my school's culture. These products are used by kids at every age, in every social circle. I'd heard about students using Juul before, but this year it really spread like wildfire. At one point, the school had to shut down one of the bathrooms because the vaping had become so commonplace. And it didn't help much, because kids were still trading pods and even vaping during class. My eyes were really opened to how big of an issue this had become when a 6th grader in my school came up to me and told me that it was easier to get someone to lend him a Juul than a pencil. Kids have a lot of misconceptions about e-cigarettes. They think that they're just inhaling the vapors and the flavors, and they don't realize that these products contain nicotine. They don't realize that the nicotine can interfere with their brain development, that the sweet flavors don't make the products any less dangerous, or that using e-cigarettes can make us more likely to try other tobacco products later on. We're so close to creating the first tobacco-free generation, but I'm worried that e-cigarettes are going to erase all of the progress we've made. This epidemic is infiltrating the lives of kids all across the country. We can't let this happen. I call on all my peers to stand strong and reject the use of tobacco products, including e-cigarettes. As honored as I am to be here, I wish I didn't have to be. I'm encouraged by the fact that our country's health officials are sounding the alarm on these products, but our parents and teachers need to know how dangerous these products can really be. Please know that I will continue to push for change, not only for my community, but for our entire country. I pledge to join the U.S. Surgeon General to protect kids from a lifetime of nicotine addiction and associated health risks. Thank you.
Mila, come on up.
Good morning. Like the surgeon indicated, I'm a substance abuse counselor for Arlington Public Schools in Northern Virginia. I'm one of 7 counselors working in high school and middle school. As a counselor, I'm deeply concerned with the proliferation and sharp increase in the use of e-cigarette by middle and high school students. The survey that we heard is true. I mean, we see it every day. Students are bringing e-cigarettes to the schools, using in the school bathroom, and at times during class. How do we know that? Because they take selfies of themselves vaping in the classroom. Some of the factors that are contributing to this increase include the belief that main ingredients in e-cigarettes are water and flavors. Fewer students and parents are aware of the nicotine content in e-cigarettes and the risk of becoming addicted to nicotine in a very short time. Other factors are that main e-cigarettes are easily concealed. Their smell is more difficult to detect. They don't smell as regular smoking cigarette. And the cloud of vapor dissipates so quickly that it's very hard for anybody to really see that somebody is using an e-cigarette. Our counselors at middle and high school level have increased the number of classroom presentations of all substances of use, but especially on e-cigarettes. They dedicate more time to outreach activities, community and parent presentations, teaching basically community members and parents about how the different e-cigarettes look like. Just to give you an idea of what we're seeing at the schools, let me give you two examples. One is from a comprehensive high school that we saw an increase between the year 16-17 school year, where only 2 cases of e-cigarettes, students were caught with e-cigarettes. By year 2017-2018, we saw 43 cases. And those are the cases that we caught the kids. You can multiply that because they smoke in the bathrooms and it's a group situation. Another example is, I work at a very small alternative high school, maximum 35 kids. Last year, we have only 1 incident of e-cigarettes in the school. This year, 4 months into the school year, we have 6 incidents. So the numbers are true. I mean, it's just an exploding problem. Therefore, this is an issue of concerns at the school level. A student addicted to nicotine will leave class to use e-cigarettes because it's not enough to go in between the breaks, so they ask permission to go to the bathroom. They spend a lot of time acquiring, using, planning when they're going to use because they're becoming hooked on it. And this compromises their attention to class, sports, and the health in general. So as a school personnel, our mission is to educate students as well as parents. Parents are caretakers for us, are the first line of defense on this problem. And they are a protective factor in the prevention of nicotine addiction and any other addiction. Parents are caretakers need to talk to the kids on a regular basis about the risks of using e-cigarettes and the impact on their well-being. Parents should increase the supervision of all the electronic devices, at home, as, supervising more. I know adolescence is a time of independence, but I think that's where they need us more. As a professional and as a parent of a teenager, I have a 15-year-old at home, I'm inviting all parents or caretakers to pledge to join the U.S. Surgeon General to protect our children from a lifetime of nicotine addiction and associated health risks. Thank you.
Thank you. Great to hear. Scott, can you join us up here? So we have new devices, and we need to adapt what we're doing. Dr. Vascones-Gatsky said that folks are taking selfies of their e-cigarette devices. So I want us all to get a selfie. We're going to do a video here, pledging, and we're going to say, we pledge to keep our youth nicotine-free. Okay, we're all going to do this together. On the count of 3. 1, 2, 3. We pledge to keep our youth nicotine-free. That's going to be on the Surgeon General's website, so I want you all to retweet that out. Thank you. Please stay up here. Thank you all so much. That was just tremendous. I want to thank Sarah and Mila. I want to thank the Secretary. I want to thank the FDA Commissioner Gottlieb for sharing their powerful stories and the work that they're doing to combat this terrible and true epidemic. In addition to issuing an advisory today, I also wanted to share that we've developed a 30-second radio public service announcement as well as a print public service announcement. You're the first to see this today, and for the media, it's in your press packets. I think it's posted up there on PowerPoint. These and other useful materials are available on e-cigarettes.surgeongeneral.gov. e-cigarettes.surgeongeneral.gov. Now, before we take questions, I need to recognize everyone in the audience: youth, parents, youth influencers, providers, who will play a role in recognizing and reducing e-cigarette use among youth. I want to personally thank my colleagues at the Centers for Disease Control and Prevention, the CDC, for their dedication and commitment to curbing youth e-cigarette use and for helping us get the science right on this advisory. The team from the Office of Smoking and Health at the CDC, especially Dr. Brian King and Corinne Griffunder, have been especially helpful. Now with that, the four of us will gladly take some questions from the media or from the audience. You all okay taking questions?
Yes.
All right. Which college do you want to go to?
American University.
American University. You heard it here first. First question. All right. Now we're warmed up.
Are there any reporters in the room with questions? Please state who you're with.
Hi, Andrew Siddons with CQ Roll Call. What do you think, why has it been such a challenge so far to communicate the risks, especially to young people?
I think that's a great question, and I'm going to ask Sarah to weigh in on that. But, you know, when you look at tobacco, we've seen this play before. They made tobacco seem cool, and they made tobacco seem safe. It took I have journals at home of doctors smoking. I collect old medical journals, and I have journals saying 9 out of 10 doctors prefer Camel cigarettes. So back in the day, folks thought that cigarettes were both cool and safe. Our youth now today recognize that cigarettes are not cool and they're not safe, but they think that e-cigarettes are both cool and safe. I'm going to use my bully pulpit to help folks understand that they are not safe, and we're using folks such as Sarah and other youth influencers to help our young people understand that they're not safe, they're not cool, and they can cause long-term problems in terms of learning, attention, memory, and priming the brain towards addiction. But Sarah, you have thoughts on that?
Yeah, I think that I would have to agree with Dr. Adams. I just want to add the point that the flavors are such a huge factor in all of this. We know that the leading reason for youth use of these products is that they flavored, and there's over 8,000 flavors, and some of the products are so clearly marketed to youth because of the way that they taste like Sour Patch Kids, or they taste like Airheads, and they taste like things that kids use, and that hides the traditional tobacco flavor that kids associate the smell of traditional tobacco and the taste of traditional tobacco with that health risk, in my experience. And I think that the flavor almost gives a false sense of security. Thank you.
I would just add, echoing the point the Surgeon General made, it's important to remember that the kids who are initiating on e-cigarettes are not kids who would have initiated on combustible tobacco but are using e-cigarettes instead. And you hear that put forward. The data shows that the kids who are initiating on e-cigarettes are kids who wouldn't have smoked and wouldn't have used nicotine but for the e-cigarettes, because we've been effective in this country at stigmatizing combustible tobacco use among youth and educating them about the risks of smoking. We haven't yet been effective at doing that with e-cigarettes. And so today is an important step forward towards that goal. The Real Cost campaign that the FDA launched, the first ever public service campaign targeting youth about the risks associated with e-cigarette use, is another important step towards that goal. The testing that we did with that public service campaign was the most effective testing in terms of the results that we saw in changing youth perceptions that we've seen with any public service campaign that we've launched around tobacco, with the exception of one. So this hopefully will be effective at starting to educate youth about the risks associated with e-cigarette use. I think we're breaking through. We have a long way to go.
I just want to add that, there is a lot of confusion about the kids. When I do my presentation and I ask, what do you think is in any e-cigarette? They say water. So when you use the word vaping, vapor, you give that impression, right? We use a vaporizer at home when a kid is sick, and they have a cold. So I think we need to start changing the language and show them, it's an aerosol. So if you get a kind of, whatever cleaner you have at home and you spray it, they get a better idea that that's what they're getting in the lungs. So we need to start changing the language in that sense and start, calling the vapor. I don't know what word we can use, the aerosol, cloud, instead of calling the vapor cloud, because vapor is misleading, and I think that's what they're taking advantage and reaching the kids, because it creates a sense that it's something, innocuous.
Good morning. My name is Laura Kelly. I'm from the Washington Times. Thank you for doing this. 2 questions, if it's okay. One, Dr. Gottlieb, I would wonder if you could give us an update on your efforts to find the reduced nicotine level that's non-addictive. And then also I was wondering if consensus is starting to build among the federal agencies that e-cigarettes are not helpful for current cigarette smoker users. It doesn't help them quit, and it's unclear what the health effects are.
So, we're committed to the idea that new product innovation can present an opportunity for currently addicted adult smokers to quit combustible tobacco and transition on to products that don't have all the same risks associated with them as combusting tobacco. And e-cigarettes and other electronic nicotine delivery systems do present one such opportunity. They need to be put through an appropriate series of regulatory gates. We're putting forward the implementing regulations and guidance that are going to lay out the pathway for demonstrating that these products can modify risk, and we're going to be putting forward some of that this year. Some of those rules are going to be coming out this year. That needs to be demonstrated through rigorous processes, and we need to demonstrate that with longitudinal studies that show that these products can help currently addicted adult smokers transition off of combustible tobacco. But we're still committed to that concept, and we believe that these do present an opportunity. As you mentioned, we're also at the same time promulgating regulation. We put forward an advance notice of proposed rulemaking. We'll be putting forward a notice of proposed rulemaking some point this year to regulate nicotine levels in combustible cigarettes to render them minimally or non-addictive. We think in a world where the nicotine levels are reduced in combustible tobacco so that combustible cigarettes can no longer can initiate and sustain addiction, that's a much different world, and we have much more opportunity to look at what alternatives could provide an opportunity for adults who still want to get access to satisfying levels of nicotine to do so through vehicles that don't have all the risks associated with them at combustion. It's also a world where if combustible cigarettes can no longer sustain addiction, it's a world where we can perhaps look at opportunities like e-cigarettes differently. They don't present all the same risks in a world where they're not going to be vehicles for addicting people onto nicotine only to watch them transition onto combustible tobacco, because that is the key concern here, that all these kids who are being initiated on nicotine through e-cigarettes, some proportion of them, and some proportion of them will eventually migrate onto combustible tobacco. And I will just sort of point out, we saw the first ever increase in combustible tobacco use, cigarette use among kids this year after years of decline. It wasn't a statistically significant increase, but it was an increase nonetheless after years of watching that decline. Does the pool of currently addicted youth account for that? We don't know, but we certainly are concerned that it could.
And thank you for those comments, Dr. Gottlieb, and for bringing it back to the kids. I want to remind folks that harm reduction is an important discussion to have, but the purpose of this advisory is to talk about the epidemic rise in youth use. So to make sure we're making appropriate use of the time and the guests that we have here today, I'd ask that any other further questions be limited to the topic of the day, which is youth use and this epidemic rise that we're seeing.
Now I'd like to take some questions from press on the phone. Please press *1 to ask a question on the phone line. Operator, whenever you're ready.
One moment while we wait for people.
We can take one more in the room while they're getting ready.
Hi, thank you for doing this. My name is Jackie Lee, and I'm with Bloomberg Law. This question is for both Dr. Gottlieb and Dr. Adams. Yesterday, the FDA posted a meeting update about the potential role of drug therapies to support youth e-cigarette cessation. Dr. Gottlieb, what type of drug therapies does the FDA have in mind particularly? And Dr. Adams, are there any suggestions as the FDA goes forward on this?
So we're going to be putting forward guidance this year looking at what additional endpoints we can use to try to promote the development of products aimed at smoking cessation. And so could we be looking at other secondary measures of morbidity that could help potentiate more development in this space? And we'll be having a public workshop around that guidance when it issues to take public comment. Specifically with respect to the meeting that you're asking about, this is a meeting to focus on how would we apply these medicinal nicotine replacement therapies to a youth population. We now have, for the first time in this country in a long time, the prospect of a lot of kids being currently addicted to nicotine. And the question is, how do you address that as a matter of clinical medicine? When you look at some of the literature and you talk to experts in this field, treating an addicted child isn't the same as treating an addicted adult. There is a lot of social factors that reinforce the addiction in children that aren't apparent in adults. And so issues like having psychosocial counseling commensurate with the medicinal therapy, if you're using medicinal therapy in that setting, become perhaps more important. But the bottom line is, we don't know. We haven't developed the literature to explore this. We don't have claims on labels of these products, the NRT products right now, that guide their use in children. We don't know what the proper dosing is. So this public workshop is a first step towards developing that scientific literature that hopefully can lead to better information to help advise pediatricians.
So the topic you're talking about is youth who are addicted. And as a public health advocate, I would be remiss if I didn't say the best way to stop folks from being addicted is to prevent them from using these products in the first place. And that's what today is all about. It's turning off the spigot, number one. Number two, we need to refit the wheel, but we don't need to recreate the wheel. Tobacco use, combustible tobacco use, has been going down for the last 2 decades. We are at the lowest level of youth tobacco use on a combustible, or across the board, all tobacco products and combustibles, that we were ever at before we saw this spike in e-cigarette use, which is reversing those trends. And so we know what works. Very practically, to any parents, teachers, folks out there, I would advise them to go to teen.smokefree.gov for advice on how to help their young person get off of tobacco products such as e-cigarettes or combustible cigarettes.
Okay, now we'll take a question from the phone. Operator, I believe you have Reuters.
Chris Kirkham, your line is open.
Yeah, thanks. I actually had a question for Secretary Adams.
He is no longer in the room. So if you have questions for Surgeon General Adams or Commissioner Gottlieb or the youth or the school personnel.
Sure. So I guess Surgeon General Adams, I was just kind of wondering if you could talk a little bit so far about your discussion. Sorry, I'm getting your feedback. While
we're working on that, should we take another one from the audience while we're working on optimizing the... You over the phone? Because I saw a few more hands, and we want to make sure we're making use of the time. Any questions for Dr. Vascones-Gadsky or for Sarah? Anyone want to ask them a question? Because they're a powerful resource here, and they're literally seeing it and living it each and every day. Got a question.
Oh, thank you. Good morning. My name is Lori McFarling with Discovery Education, and thank you so much for this morning's advisory. And Sarah, I have a question for you. In the classroom and at school, how have your peers reacted to your leadership? And what, in your opinion, is the most effective way that you've been able to convince your friends that vaping is wrong and is harmful?
I think I'd like to point out that the easiest kids for me to make headway with are those that are younger than me. Like, my school is a 6 through 12, so the 6th, 7th, and 8th graders are the easiest for me to talk to because this is where it's starting out, and they tend to look up to the upperclassmen, so I think I have a little more I think I'd like to point out that the easiest kids for me to make headway with are those that are younger than me. Like, my school is a 6 through 12, so the 6th, 7th, and 8th graders are the easiest for me to talk to because this is where it's starting out, and they tend to look up to the upperclassmen. So I think I have a little more authority with them, maybe. The older kids, it's really hard because of this culture of vaping and because these products have become so normalized. And so I think a lot of it is just breaking down those myths that they believe about that it's just vapor or that there isn't actually nicotine in them, even though, like, I had someone tell me that there wasn't any nicotine in a Juul, even though a Juul has as much nicotine as an entire package of cigarettes. So I think a lot of it is trying to correct the misinformation, and not everyone necessarily wants to hear what I have to say. And I think if you don't want to hear what I have to say, then you need to hear it the most.
We're going to try the phone one more time. We request that the person asking the question turn their audio down. No, it's not working. Oh, okay. Were there any other questions from the phone? Because we're running out. No. Okay. Well, are there any last call for questions in the room from press? No? Okay. Hold on.
Question to Sarah. What flavors are kids using most?
I would say that it's pretty across the board. I know with Juul, the most popular in my high school is the mango flavor because it's the fruit flavor, but there's really all kinds of different products. I'd say the ones that taste like candy are more popular with the younger kids, and the ones that taste like fruit are more popular with the older kids. But really, all of the products are, maybe not meant is the right word, but all of the products are attracting young people.
And I want to hit another point there, too, because advocates out there will say that adults like flavors, too, and that is true. The percentage of adults using these products is 3%. The percentage of high schoolers using these products is 20%. So, again, we need to try to find some balance here, both in terms of marketing and availability of flavors, and restore some sense of normalcy, of common sense to the way we're making these things available. We want to preserve the harm reduction potential for adults, but it can't be at the expense of our young people.
Thank you so much. That concludes our press conference.